Hi everyone, welcome to another edition of Dojo Live. This week we're having a double whammy. Today we have Alex Iceman as our guest, and we're going to talk about the use of AI, artificial intelligence, and how that can be applied into helping scientific discovery for cures like cancer or what's going on today, COVID-19. So it's going to be an interesting conversation. I hope you join us. I am joined by my co-host, Carlo Ponce, who is in Mexico City, and Mariel Navarro, who is in Chihuahua, and Alex joins us from Yosemite in his home, and I'm in Los Angeles. Welcome, everyone, and welcome, Alex.
Hey, Tulio. Thank you
Hey,
for the
hey,
introduction.
Taylor. Thanks for having me.
Alex, please introduce yourself. Tell the audience a little bit about you, who you are, and that'd be great. Thank you.
Thank you. My name is Alex Iceman. I'm the CEO of Genium, a software engineering company, and I've been an engineer myself for the last 10 years, 10 plus years. I've been working on operation systems, C++, moved into mobile development, and eventually started my own business, and we grew into a company of 90 people right now and growing. I'm a professional athlete as well. I'm a professional hockey referee for the American Hockey League, and kind of juggle in between the professional sports and being entrepreneur and building business. So doing my best to excel at both trades, but probably 70% of my time goes to my business. I'm also a student pilot learning to fly and play a few musical instruments, including piano, saxophone, and clarinet. It's probably kind of short introduction.
Sounds like a very multi-dimensional life. I love it. So I'm curious: is Iceman like your official last name, or is that something related to your hockey career?
Good question. So, Iceman is a business nickname. Was given me by one of my first clients. The original last name, Eastern European last name, is Ladovsky, and that literally translates as "man of ice." And unrelated to hockey is just the way I've got my last name through my father. And
Brilliant, brilliant. We love it.
right.
We love it.
So nobody could remember last name Ladovsky, and they would stagger for a second. And my first company was named Iceman Softworks, and they would say Alex from Iceman, and then they skipped from, and they start calling me Iceman, and then I just rolled with the punch and said, okay, I'm just gonna go by Iceman now.
Nice. Tell us a little bit about Genium. What do you guys do?
Genium is a premium software consultancy agency. We focus on building high-end mobile applications, web applications, and we also do stuff augmentation for companies that require additional cybersecurity requirements or anything around data security and high-quality software engineering. We work with security biometric companies that handle a lot of the sensitive data and therefore require a very strict software development process, including unit testing and just in general high quality engineering with some sort of security requirements.
Wow, today with what's going on, cybersecurity is probably a pretty hot topic. Carlos, what's the topic of conversation? Let's jump right into it today because I'm curious to get us talking about this very important hot topic on how we can use AI to solve some of the problems we're facing right now. What's the topic today? Please introduce the show.
Yeah, absolutely. Thank you so much, Tulio, and thank you, Alex, for being with us today. Alex, I believe that for today's conversation, you chose a rather intriguing, to say the least. I mean, that's what we have discussed here internally. A rather intriguing topic, and of course, equally interesting is exploring the limits. Okay, so it's exploring the limits, or in other words, how can AI and software can help find solutions for rather considerable illnesses like cancer. So I would like to ask you, first of all, why did you choose this particular topic, Alex, and then we can go from there. Thank you.
Thanks for the question. So I really I'm interested in this topic. First of all, my first major is biochemistry, so I'm applying that together with my second major, which is computer science and cybersecurity, and both combined give me an interesting broad perspective on the medical field and how software and machine learning in the first place can influence and impact that industry. Personally, I had a close call with cancer myself. Moved here to California about 10 years ago. My skin obviously didn't get used to that sun, a pretty aggressive sun, and one of my moles started to kind of change, and I went to check it out, and then they said, well, you're one step away from cancer, from melanoma. They had to cut it out. And when I saw that they were still using tools from I don't know, 18th century, when they were just literally cutting it out, I thought that something is wrong. Something has to be done about that. There has to be a better solution to that problem. And everybody I talk to, cancer or some sort of critical disease touched any family, pretty much anybody I know, either directly or indirectly, their family members. And I have a cancer history in my family as well. My grandma died of cancer. So I started looking into that topic more and more, see what's up and what is the process, what cancer is. And just as I like to learn things, I break it down to the simplest form possible, and then building on top of it back to see what is the possible solution to that problem. So that's how I started. That's what fascinates me the most about this topic.
Thank you so much, Alex. Okay, Marielle, do you have anything? Before we continue with the questions, of course. But
I know. Actually, I have questions already.
Cool. Go ahead, please.
Well, just first off, a simple question. We're talking about AI software to help healthcare problems. Is there any example that you can give us, like AI being used right now for certain?
Absolutely, great question. So IBM is one of the interesting companies that started to lead the way in terms of applying machine learning and AI to solve real world problems. And several years ago, they came up with a product called IBM Watson, and it's an artificial intelligence computer and a platform that allows doctors to diagnose patients really quickly by just entering their symptoms and all the data they have, including test results and everything, into the system. And in the United States, a few hospitals are using that system right now, as far as I know. And it basically helps doctors to keep up with all the trends and aggregate all the statistics and see what is the potential cure with a certain percentage of outcome curing cancer. And they're particularly focused on cancer. Where that solution really took off is surprisingly China, but not surprisingly. China has a long-standing problem of health industry. They have a lot of people. They have to build a lot of hospitals, and the demand is phenomenal. So they have doctors, and a doctor cannot keep up with all the new researchers and research and all the data that is coming out on the market, because they have to constantly work and treat the patients. And there's pretty much very little room to study new stuff, but they still keep doing it. But for a person, it's impossible to digest information from all around the world and categorize it and find the best solution that's available on the market. So IBM Watson came into China, and they partner up with quite a few hospitals, and they're using it on a daily basis now, where a patient comes in with, as far as I know, and China is not very open about how they do things, but as far as I know, they use it for diagnosing cancer and suggesting the best possible treatment. The way it works, doctors put in all the information about the patients and patient in a machine. So it's a computer, it's a program, and then machine analyzes it, compares it to tens of thousands of similar cases, and then you can add specific parameters, like a person doesn't want to lose hair, or a person doesn't want to do this and this. So you ask what is the best treatment, plus specific options that you want to have, and then it lists out potential treatments for you with a percentage of success. And then doctors, instead of trying to think what is the best, they can just pick and choose, because machine already analyzed tens of thousands of cases, and they've pretty much gave you a treatment solution. So the statistic says that machine accurately gives you, or AI in this sense, accurately gives you a diagnosis and a proper treatment at 98% of the cases. And doctors, I think, from not I think, I saw the statistics in China, diagnosed it at 96%. So machine gives you a 2% better chance of getting the right treatment.
Wow. So I'm familiar with how AI is used, for example, in to improve customer journeys, specifically when you have enough data and information about a customer base and it's large enough of a data set that it can permutate various scenarios to try to personalize something for every customer, right? I'm very familiar with that. A lot of companies have been very effective with that. So the key thing that's always popped up for me is this critical capability that you just can't get enough humans to do, which is the constant permutation and variations, the basically endless A/B testing that can be done with AI. How do you think there could be better collaboration? I mean, we're in the middle of a pandemic globally. I'd be curious about, there's so much data coming out. The speed in which that data can be analyzed is just not going to be possible with human beings unless you apply something like this. How do you think people could use that, or who could use that, or other organizations can apply some of these AI principles, some of these computing principles, to try to find some solutions that are very relevant and affecting every single one of us right now?
Right. Great question. Thank you for that. A great example. And in fact, companies are already doing that right now as of today. President Trump announced that they're letting private companies to use government supercomputers to plug in all the data and simulate how the outbreak of COVID-19 will affect the United States. And that's exactly right. A person cannot analyze 100,000 of points of data. They have to put it all in, clean it up, and then let the machine analyze where things are going, and then compare it to Italy or China and see day by day where things are. Plus, when you add demographics, once you add pregnant women, once you add teenagers, elderly, and then break it down literally year by year, plus you add pre-existing conditions, creates for like billions of possibilities. And the only way we can analyze and get a grasp on that data is to use supercomputers. Not necessarily AI in that sense, more of a machine learning and data analytics. But it's, machine learning is the first step towards AI, and AI is a sophisticated machine learning algorithm and a program that self teaches itself and moves forward. So we're already doing that as of today, using it, and we just need to use it more. The problem with data, second part of the question, the biggest problem right now is to share data, and it's a medical data, especially in the United States. Hospitals own the data, universities own the data. They don't really share that data that much in between different organizations. And when we started a small project to try and build a specific machine learning algorithm to analyze cancer DNA mutations, the first problem we faced is as a private corporation, there is no way to access big sets of data, which is essential for building machine learning capabilities. So that's the big problem.
So, but do you think, based on what's happening, there's a lot of those barriers being removed, and they rightfully need to be removed, even some of the barriers between countries. Do you think in some ways this challenge, this epidemic, this global crisis might open up some more collaboration and potentially create collaboration that can create cures for other things that cause many, many deaths globally? It could turn out to be a blessing in disguise. I hate to call it that way. If what happens is some collaboration, what do you think needs to happen to get there, in your opinion?
Honestly, I think the leaders of opinion and leaders of large corporations have to influence governments, and I think that's the way it should be, because government is. It's hard to say they're useless in this scenario, but I think the people with power, like, I'll name a few. Elon Musk. We can talk about Google's executives. We can talk about Tim Cook. We can talk about Jeff Bezos. Those people have to come together. Mark Zuckerberg, and I think they should, and they already doing that. And Bill Gates, they have initiatives that do a lot of that stuff. but they have to combine their efforts into sharing data and then establishing grants and everything for companies who are willing to work in that domain. And I think private corporations will get things done much faster. It's just there has to be collaboration of those top companies, and in China as well. The problem is it's a lucrative business, and people don't want to just share data because data costs money, and patients' data also very expensive when you want to buy it on the market, and there are ways to do that, but it costs a lot of money. And as I said, we're, as a private organization, we're not able to even access that data legally or illegally in any way in the United States. So I think the pandemic will definitely help to share data on COVID-19 and specific things, but I doubt that it's going to trigger a massive data share among different countries. And we already see that countries like Russia and countries like Iran and other countries are withholding information. They're not giving the true information what's going on right now. So only a handful of countries are truly giving that information out. And in fact, I don't think that they're giving out the exact cases which we need. I mean, like the patient's data. They're giving you specific statistics, but they're not giving you the actual raw data to analyze, and there is no way you can access it.
Well, that's a shame. It sounds like the private sector perhaps should rally to figure out a way to work around that. So, any other questions, you guys?
I do have a question related to that. So in that scenario, it's hard to get information needed to feed these AI systems from companies, maybe hospitals. But can it be done like through the actual patient, like creating a program with about information exchange, letting them know that they're helping to build software is probably going to help with their illnesses or maybe future illnesses they might have?
That's a great question. That's a great question. Thanks for that. Companies are already doing that. However, that is heavily regulated because you're getting a lot of patient's data information. Even if a patient voluntarily shares it, it's still regulated by the government. And you will be considered a medical institution or some sort of institution that holds personal data, and you have to comply with a lot of interesting standards here all around. Cost billions of dollars to comply with those standards, and it pretty much is treated as a hospital. Medical industry here is like enormous expensive with all the insurances and everything. So prices are really jacked up, and but there's been attempts. People have failed to gather information like that, and they were shut down. But there are different other solutions. So, for example, there are companies that provide, and that's what we are trying to do as well. They're providing an algorithm to anonymize patients' data. So instead of getting the actual data, like numbers on, let's say, blood tests or actual numbers of the tests, you use a specific encryption algorithm, and you encrypt it, and you change data to a point where you cannot recognize numbers or names or anything. So those are just numbers, and then you analyze those numbers. And of course, there is a function that converts, let's say, 2 to 1,700,000 something, and then all those different numbers would be converted to another big number, and then you work with this big sets of data that are not even relevant to the actual numbers. So you anonymize and encrypt and put a specific cipher on top of the real data. So if we were to analyze patients' data, we would have no idea about the actual data, but we don't really have to know the actual numbers to analyze the data. And then we would give our results back to the hospital, and they can decipher it back and see what the results are.
That's a pretty big problem. I'm actually a QA engineer, and I know like getting real data to test it's hard. And if I don't know, I think people doesn't have in mind that if they want quality software, at least information is crucial part of it.
I got a question of my own, Alex. Before you got to the broadcast for today, we were having a conversation around how timely the topic of today's conversation was, for obvious reasons, right? We're talking about things that are happening out there that could jeopardize a lot of people's health, and so on and so forth. So my question, and this is coming from someone who's not an engineer, I don't have an engineering background, so my question would be more along the lines of, what would you say to all the naysayers out there that are like, come on, is this really possible? So you might have encountered, all the great ideas in the world, the ideas that have changed and shaped the world have encountered such resistance at some point or another. So what would you say to the naysayers out there?
Honestly, I don't really pay attention to no's and negativity. So if it's their own life, if they decide not to believe in it and they have their own problems,
Right.
I don't mind it. So there's always enough people that would stand by me, or try to make the world a better place in any shape or form. And I would rather spend my energy elevating what I'm doing right now and talking to people like yourself, rather than trying to convince people that are saying no and it's not going to happen. So I'm not going to waste my energy. Because I've got one life. It's pretty short. I would love to contribute to the world the way I can, and I would focus my energy on doing the right thing. And then at the end, that's what matters.
Okay. Yeah, and we're totally with you. And probably, I don't know. I would probably add, and then I pass on the mic to my teammates. Probably add that to the question from the business perspective. I mean, if you want to get your technology out there, your approach out there, and talk others into adopting what you have to offer and your value proposition, but you still face some kind of resistance. Let's put it that way. What would you tell them? How would you define your proposition in terms of increasing adoption?
Look, I honestly truly believe in a good product, and if you have a good product and a good idea, it doesn't really need marketing. So if we're talking about curing cancer, or not curing it, it's a very bold statement. I'd rather stay away from it, but contribute towards finding a solution to cure cancer. And my personal approach, by the way, is a personal immune therapy. So I think we should use our own immune system cells to fight cancer. We just need to help our own immune system and our own body to recognize cancer cells quicker, and then just kill them. In fact, our bodies are generating cancer cells every day. It's just a wrongly mutated cell, and we have millions of those every day. And our immune system is capable of finding those and just killing it as a bad mutation. It's just when the immune system gets weaker, it's not able to catch up with that and then keep up with the wrongly mutated cells, and you're getting more and more of these, and eventually they grow into cancer. So basically, we need to help our own immune system to fight that and identify those mutations. That's where, and I truly believe that's where AI and machine learning can help, because our body and our immune system is not able to detect the cancer cell mutations, because they mutate thousands of times throughout their lifespan, and our immune system is not able to keep up with it, and that's why we're not even able to identify them quickly and kill. And to this point, cancer has its own mechanisms of fighting and fighting back and fighting our immune system, which is surprisingly what I didn't know. And through AI, we're able, eventually we'll be able to analyze possibilities of the next mutation and target that next mutation before it happens or as it's happening, and then gear our immune system towards killing those cells and identifying them. That's the biggest problem. Cancer is a pretty simple problem. It's a wrongly mutated cell because it's your own cell. Your body cannot recognize it's a pathogen, and it just keeps mutating up until it takes over a specific organ because it's multiplying and your organs start to fail. So it really comes down to a wrongly mutated cell and identifying it and killing it before it spreads and mutates more and more. So
thank you so much.
Right, to add to that point, I would really say, look, it has to be broken down like this, pretty simple. That's the problem. That's the solution. If you see how we can put one and one together, join us. And that's what we're doing. And there's enough people affected by cancer that would be happy to help. And I get messages from a lot of people just asking how we can help. and there's enough demand for that for sure. I don't think that this problem needs convincing or marketing. People know that either have the population in the United States, majority of it either dies from cancer or from cardiovascular diseases. So there's enough market to, if you're talking about business, there's enough market for that problem,
Okay.
for sure.
Thank you so much, Alex. Tulio.
Yeah, well, you're making some really interesting point, Alex. And as I'm listening to you, the only thing I keep thinking about is I really hope that what's happening serves as a bit of a wake-up call that in order for us to find solutions to some of the things that are making life really just miserable for millions of people, more collaboration is needed, less regulation is needed, and more trust needs to be put into the hands of the researchers and scientists who are actually trying to make people's lives better. And the equation of profit and over health, that's something that needs to be solved as well. I mean, because it seems as though this may not be the one that gets us fully, but the next one might. So we just have to get there, right? So clearly that's an opportunity to kind of wake up and do a little bit more collaboration worldwide on these issues. So where are you now with what you're working on? Any promise specifically to cancer? I see that's been an area of focus, main area of focus for you. Any promise you're seeing? Any light at the end of the tunnel you're starting to see based on some of this private sector collaboration and use of supercomputing and research that's being done? Are you seeing some potential light at the end of the tunnel yet?
Sure, it's a great question. So primarily right now we are focusing on growing our company and building a community of best engineers that work with high tech companies here in California and New York and throughout the United States, and we're expanding to Spain. My goal is to tap into the top talents, top engineers, and build a network of top engineers. And we already have PhDs that do machine learning and computer vision analysis, and we're growing that network that work for our clients. And once they have their free time or they want to collaborate and contribute to that product and problem, we allocate them in a research team that works on a specific machine learning algorithm. And right now our goal is to build a small machine learning algorithm that analyzes DNA data, cancer DNA data, and tries to find the markers of specific cancer cells. So we can identify markers really quick and then target our immune system back to attack those markers on the cancer cells. We're just at a stage where we are building the machine learning. We've faced some problems with getting data, and I'm still working through it, but we're literally allocating 1% of our time and budget from the company towards this problem, as we still, a relatively small company, about 90 people, and we were growing, and it really takes 1,000 to 2,000 people in a company to contribute even more to that problem and more engineers. But to add to the point, COVID-19, I think it's a great opportunity for corporations right now, and we already see the market prices for medical companies are raising up just because of the problem. They're going to pour more and more money into that problem, and that's where I said the businesses have to step in, because once they see profit, they'll work really, really hard to solve that problem. And I as long as it's not a monopoly, as long as we have multiple companies chasing it, and it's an open market, then the prices will be at the reasonable range. We just need to let those companies go and find a solution. With COVID-19, I'm sure there'll be the next one and the next one, the next one. And right now, companies have identified that that's a great market opportunity. It's the whole world market, and if they're able to come up with a solution to get a vaccine early enough for the next thing, then they'll be a $1 trillion company, because they'll be able to produce it faster than everybody else. I'm sure it's a great business opportunity. Companies will jump into it, and they will create solutions. As far as cancer treatment, I've seen there's Seattle, and actually United States and China are leading the way in immune therapy, and they're already doing this. They're already identifying common cancer cell markers, and they use immune system therapy to fight cancer successfully. For leukemia, I've seen very good, promising results for leukemia, where almost 90% people recover fully from trials that I've seen. And basically, since it's in your blood, it's easier to access. And one of the biggest problems of immune therapy is accessing the cancer tumor. Because if it's somewhere where it's not super accessible by the bloodstream, it's hard to attack it with your own immune system cells. So there are different challenges, of course, and you have to apply different multiple techniques. But I've seen some promising results. I don't have a time estimate for anything, but I see that trials are happening right now. Human trials are happening right now, which is promising, which means that people can get into that thing. And I would definitely look into immune therapy for treating specific cancers that are treatable this way. So that's already happening here in China.
Well, Alex, at least from when it comes to cancer, there seems to be some light at the end of the tunnel here. So some good news in the midst of everything that's happening right now. Thanks for being with us. We're up on time already. Guys, anything you want to add? Otherwise, let's wrap up.
Great. Well, no, the only thing is to send you a big, heartfelt, warm thank you, Alex, for having been with us today. And I'd like to just make a quick announcement about next week, because despite all the lockdowns that we're all facing, we're still going to be broadcasting on Dojo Live for a number of weeks, for a long time to come. Next week, we're going to be having a conversation with David Meltzer, the CEO of Sports One Marketing. And I believe, Tulio, correct me if I'm wrong, but I think he's the one that's going to bring us this other, the football player turned entrepreneur. Am I correct? Do you have the name, or is it something else?
No, David's a personal friend. He's one of the top 10 speakers and coaches in the world.
All right.
And actually, it was one of his agency guys that connected us to Alex. So good. Can't wait to speak with him. We were going to do it in person in his office, but obviously because of the stay safe at home orders here in Southern California, that's not going to happen. But I'm looking forward to having him on the show. It's going to be a very positive and encouraging show, and it's going to be fantastic to have him. Thanks for everyone to join us.
Thank you, everyone.
And we'll see you guys soon. Stay safe.
See you soon, guys. Thank you so much.
All right. Goodbye.
Bye.